Dear students, last video I had discussed about the pharmacological actions of the acetylcholine and just mentioned about the classification about the cholinergic drugs, that is the directly acting and the indirectly acting cholinergic drugs. So in this video I'll be dealing with the directly acting cholinergic drugs. So directly acting cholinergics, you know how they act directly through the muscarinic receptors or the nicotinic receptors. So we call them as cholinergic receptors. So they act directly through this muscarinic or nicotinic receptors and exert the response or the pharmacological action. Okay, so they are esters and alkaloids. Esters are acetylcholine, carbachol, methanol, and we have the alkaloid, that is pilocarpine, mascarin, and the ericholine. So these are the directly acting cholinergic agonists. So they mimic the action of acetylcholine. How? By binding to the muscarinic or the nicotinic cholinergic receptors. So we have the cholinomimetics. So why acetylcholine? It is not used in the clinical practice. So why is it not used? Is it is given orally, it gets rapidly destroyed in the GI tract. So, but if it is given IV bolus, it gets rapidly metabolized by the plasma pseudocholinesterase and at the site by specific true cholinesterase. So that's the reason acetylcholine is not used clinically or in clinical practice. So we have the cholinomimetic drugs, the directly acting or the indirectly acting drugs. So what are the advantages of this directly acting drugs or the indirectly? So like they are effective orally, more specific action, selectively it binds to that receptors, cholinergic receptors, and it acts directly at acetylcholine receptor agonist. So that's the reason we are not using acetylcholine. Instead of that, we use the cholinergic drugs, either directly acting or the indirectly acting ones. Okay, so about the esters of choline, that is bethanol, it has predominant muscarinic action. It doesn't have any, the nicotinic action is, it doesn't have any nicotinic action. Mainly, it predominantly muscarinic action it has got, and it is resistant to the hydrolysis by both the esterases. Which are the both the esterases? Acetylcholinesterase and the butyrylcholinesterase. And mainly it acts on the, in the urinary bladder and in the detrusor muscle, all these muscles. So it stimulates the detrusor muscle. Okay, so and even in the GI muscles it has got action. So prominently in the uh, in the uh, the detrusor muscle, in the urinary bladder, and even in the GI muscle. So what are the indications? Like post-operative urinary retention. So especially in the non-obstructive urinary retention, it is being used, and to facilitate the emptying of the neurogenic bladder. It can be due to any injury in the spinal cord or like that, if there is any neurogenic bladder. In such cases, neurogenic atony, megacolon, postoperative paralytic ileus, rarely it is used, gastric atony. So in all these conditions, it can be given orally as tablets or as subcutaneous injections. So these are the indications of the bethanol. Since it is not hydrolyzed by the esterases, acetylcholinesterase and butyrylcholinesterase, it has got a longer duration of action. Now, what are the adverse effects? Adverse effects are like flushing, salivation, sweating, and the gastrointestinal adverse effects are like abdominal cramps, diarrhea, belching, and difficulty in facial accommodation, syncope, bronchospasm, cardiac arrhythmias, and involuntary urination. These are the adverse drug reactions associated with the use of bethanol. And contraindications like in asthma patients, COPD patients, gastritis, peptic ulcer, because all gets aggravated. So that's the reason it is contraindicated. If there is any GI or urinary obstruction, so that's what I mentioned. So in such cases also it is not recommended. So these are the adverse effects and the contraindications of bethanol. Now about the choline esters, that is the methacholine and bethanol. I told no nicotinic action they have, but methacholine has got prominence cardiovascular action. Carbachol and bethanol, they act in the GIT and the urinary bladder. I told this, that bethanol predominantly acts in the urinary bladder and the GIT, and carbachol and bethanol both are resistant to the hydrolysis by the acetylcholinesterase. So mainly among these cholinergic drugs, Okay, bethanacol and pilocarpine, these are the one which is used ester, among the ester bethanacol, and among the alkaloid pilocarpine. Okay, these are the ones which are used clinically. Okay, now about the pilocarpine. Pilocarpine, it's an alkaloid. It's called in a mimetic. From mimetic, the name mimetic means that mimics, isn't it? So alkaloid, it's obtained from the, why it has been called alkaloid? Because it is obtained from the plant, that is a Pilocarpus microphyllus plant. It has been obtained. So it has got nicotinic action, muscarinic action, but predominantly it is the muscarinic action. So mainly it has got action on the eye, and it penetrates the cornea, producing the miosis. Okay, no, what is miosis? Is the constriction of the pupil. Pupil size will decrease, and since there is it has got action on ciliary muscle, it causes ciliary muscle contraction and the spasm of accommodation. So you can see the difference between the eye which is treated with the pilocarpine and the normal which is untreated. Okay, I have shown this some image in my previous video also. So it is available mainly in the form of drops, pilocarpine ophthalmic drop solution, it is available. Now about the uses of the pilocarpine. It is a third line drug used in open angle glaucoma as well as angle closure glaucoma. So why is it being recommended in glaucoma is it acts within minutes. Within minutes it acts, and it helps to lowers the intraocular tension or the intraocular pressure in eye. That is by acting, it helps in the drainage of the aqueous humor. Okay, that is by it is so it is a choice of emergency for lowering the intraocular pressure. So it opens the trabecular meshwork. It opens the trabecular meshwork near the canal of Schlemm, and it helps in the drainage of the aqueous humor. So it acts within minutes, and the duration of action is about 4 to 8 hours it acts. So that's the reason it is being preferred in the open angle glaucoma and closure glaucoma. Then it was also used as a miotic. Okay, then where it is used as a miotic to counteract the action of a mydriatic, because mydriatics are the one which are used to dilate the pupil to test the refraction error. So in such cases, to counteract the effect of a mydriatic as a miotic, it has been used. Other use is to break the adhesion of the iris with the lens of the cornea, and it is also beneficial in promoting salivation in patients with xerostomia, because those patients who are undergoing radiation therapy for the head and neck cancers, they will be having xerostomia. Okay, so to promote salivation, pilocarpine is used. And another use is in xerophthalmia. Xerophthalmia can also occur due to Sjogren's syndrome, which is an autoimmune disease, or it can be due to the vitamin E deficiency or due to the aging. Okay, all this can lead to xerophthalmia, or increased screen use. All this can lead to xerophthalmia. So in xerophthalmia also, this pilocarpine is recommended. Another use, as I told you, is Sjogren's syndrome. It's an autoimmune disease. So again, as I told you, we have the solution in the form of drops. Okay, ophthalmic drops are available, so that has been recommended. About the adverse effects, initial stinging sensation will be the painful spasm of accommodation, blurred vision, sometimes night blindness and raw aches. It is also seen with the pilocarpine drops. So these are the adverse effects seen with the pilocarpine. So that next is about the cholinergic alkaloid. It's a muscarine, poisonous mushroom, and ericolin that is present, you might have seen in the betel nut. It's a mild euphoria induction. Okay, so that's all about the cholinergic drugs. These are the references for further reading. Okay, thank you, dear students. Happy learning.